You started feeling a strange dizziness when getting out of bed. You noticed you were more tired than usual. Your feet started swelling by the end of the day. And you told yourself, it's just age, everyone goes through this. But what if it's not just age? What if your body has been trying to tell you something, and you've been answering back with silence? Today I want to talk directly to you, the person who takes Losartan or Amlodipine every day, who follows the routine, takes the pill, and still feels like something isn't quite right. Because there are signs the body sends that millions of people ignore, for months, sometimes for years. And when they finally mention it to their doctor, the doctor says, "Why didn't you tell me this sooner?" Today you're going to learn the 7 signs that people on Losartan or Amlodipine should never ignore. Not because these medications are dangerous, but because your body deserves to be heard. Because we talk about health here the way a trusted friend would. No complicated terms, no unnecessary fear. Just what you actually need to know. Losartan and Amlodipine are among the most prescribed medications in the United States, and for good reason. They work. They protect your heart, your kidneys, your brain. But here's what nobody tells you clearly enough. Even a medication that's helping you can sometimes cause effects that need attention. That doesn't mean the medication is wrong for you. It doesn't mean you should stop taking it. It means your body is unique, and what happens inside it deserves to be monitored, not ignored. There's a belief that I hear all the time, and it worries me deeply. People say, "I've been on this pill for years. If something was wrong, I'd know." But that's exactly the problem. Some of the most important signs don't announce themselves loudly. They creep in slowly. They blend in with daily life. They look like tiredness. They feel like age. They sound like something you should just push through. And so people push through. They stop going on walks. They stop seeing friends. They stop doing the things they love, not because they made a choice, but because their body is quietly telling them something they haven't learned to listen to yet. The danger isn't always the medication. The danger is deciding that every symptom is just getting older. A woman I'll call Margaret, 67 years old, retired teacher from Ohio, had been on Amlodipine for 4 years. She noticed her ankles were getting puffy in the evenings. She didn't mention it to her doctor for almost a year. She thought it was because she'd been sitting more. When she finally brought it up, her doctor adjusted her treatment the same week. 1 conversation, 1 appointment, 1 year of unnecessary discomfort that could have been avoided. That's what this video is about. Not fear, not alarm. Awareness. Here's how people describe it. My shoes feel fine in the morning, but by the afternoon I can barely get them on. My socks leave a mark on my ankle that doesn't go away. Why, I thought I just needed to drink more water. Sound familiar? This type of swelling, called edema, can happen in some people who take certain blood pressure medications, including Amlodipine. It's not rare, and it's not automatically a cause for panic. What happens is this. The medication relaxes the blood vessels, which is exactly what it's supposed to do. But sometimes that relaxation causes fluid to shift downward into the lower legs, ankles, and feet. It tends to be worse at the end of the day, after you've been on your feet, and better in the morning after lying down. So when is it okay to just monitor it? If the swelling is mild, only appears in the evenings, goes away after resting with your legs elevated, and isn't getting worse, it's worth mentioning at your next appointment, but it's not necessarily an emergency. But when should you call your doctor sooner? If the swelling is getting worse quickly over days, not months. If it's affecting both legs significantly and doesn't improve with rest. If it comes with shortness of breath, especially when you lie down or at night. If you notice swelling in your face, around your eyes, or in your hands. That combination, swelling plus shortness of breath, is one your doctor needs to hear about promptly. Not next month, soon. One more thing. If you're taking Losartan and notice swelling, particularly in the face or throat, that's a different kind of alert. And I'll talk about that in detail when we get to sign number 7. That one requires immediate attention. But for the ankles and feet, take note. Take a photo if you want. And bring it up at your next visit. Here's how people describe it. I get up from the chair, and for a few seconds everything spins. I have to hold on to something before I can walk. I thought I just stood up too fast. This feeling has a name, orthostatic hypotension. It simply means that when you change position, especially going from sitting or lying down to standing, your blood pressure drops temporarily before your body can compensate. Blood pressure medications, by design, lower blood pressure. And sometimes, especially in combination with other factors like mild dehydration, heat, or even just the time of day, that drop happens faster than your body can adjust. Here's why this matters more than people realize. Falls are one of the leading causes of serious injury in adults over 60, and a dizzy spell that lasts just 2 or 3 seconds is enough to lose your footing, especially on stairs, in the bathroom, or on an uneven surface. When is it okay to monitor? If it's occasional, mild, and you've learned to pause for a moment after standing, mention it to your doctor. But it may just require a small habit adjustment or a timing change in when you take your medication. When do you call? If you've already had a fall, even a minor one. If the dizziness is lasting more than a few seconds regularly. If it's happening multiple times a day. If it's getting worse, not better. Do not normalize falls. Do not tell yourself I caught myself in time. Tell your doctor. That's exactly the kind of information that can prevent a serious injury. Here's how people describe it. I used to walk around the neighborhood every evening. Now I get tired just thinking about it. I stopped accepting invitations because I knew I wouldn't have the energy. I sleep 8 hours and wake up exhausted. Fatigue is tricky. It can come from so many places: stress, poor sleep, other health conditions, even sadness. So people rarely think to connect it to their blood pressure medication. But here's what's worth understanding. Some people do experience fatigue as a side effect of certain antihypertensives. And beyond that, fatigue that's new, persistent, and affecting your quality of life can be a signal from your cardiovascular system that something needs attention. What really concerns me, and I say this not to alarm you, but because I think it matters, is the social withdrawal that comes with unexplained fatigue. People stop going out. They stop calling friends. They stop enjoying things. And sometimes they accept this as just getting older. But vitality is not something you should simply surrender to age. If you used to walk, garden, cook, travel, and now you don't, and the reason is exhaustion, that deserves a conversation. Not self-diagnosis, not resignation. A conversation with your doctor. When do you call? When the tiredness is new and has lasted more than 2 to 3 weeks. When it's affecting your daily life in ways you've started to accept as normal. When it's combined with any of the other signs on this list. If what I'm saying is making you think of someone you love, a parent, a spouse, a friend who takes these medications and keeps saying, "I'm fine, it's just age," share this video with them right now. Tap the like button too. It tells me that this kind of honest, calm conversation is what you want more of. And it helps other people who need this information find it. We still have 4 more signs to cover, including the ones I consider the most important. Sign number 4 surprises a lot of people because they never connected it to their blood pressure medication. Sign number 7 is the one I want every single person watching this to remember. Let's keep going. I keep clearing my throat, but nothing helps. I thought it was allergies. Then I thought it was a cold. Then I just stopped thinking about it. My family keeps asking if I'm sick. I tell them I'm fine. But the cough never leaves. Here's something that surprises a lot of people. A persistent dry cough is actually a well-known side effect, not of Losartan or Amlodipine, specifically, but of another class of blood pressure medications called ACE inhibitors. Medications like lisinopril, enalapril, and ramipril. If you or someone you know takes one of those, this is especially relevant. I'm mentioning it here because many people watching this may take more than one blood pressure medication or may have switched medications in the past. And because this cough is one of the most commonly misidentified symptoms out there, people spend months treating allergies that aren't allergies. They take cough syrup that doesn't work. They avoid going out because they don't want to cough in public. Some even start to worry it's something serious like a lung problem, when the answer was much simpler. Not every cough is a cold, not every cough is allergies, and not every cough needs cough medicine. Sometimes a cough is your body saying, this medication may not be the right fit for me. And that's a completely solvable problem with one honest conversation with your doctor. When do you call? If you've had a dry, tickling cough for more than 3 to 4 weeks with no other cold symptoms. If cough medicine isn't helping at all. If the cough is disrupting your sleep or your daily activities. If it started around the same time you began or changed a blood pressure medication. You don't have to live with a cough for a year wondering where it came from. There are options, there are alternatives. But your doctor needs to know it's happening. Sign number 5, muscle cramps, weakness, or a strange feeling in your legs. Here's how people describe it. I wake up at night with cramps so bad I have to get out of bed and walk around. My legs feel heavy, like I'm walking through water. Sometimes there's this strange tingling, not painful, just odd. Muscle-related symptoms are another category that people tend to attribute entirely to age, to overdoing it, or to not drinking enough water. And sometimes that's true. But here's what's worth knowing. Blood pressure medications can, in some cases, influence the balance of electrolytes in your body, particularly potassium. And when potassium levels shift, muscles are often the first place you feel it. This doesn't mean your medication is harming you. It means your body may need monitoring. A simple blood test can check your electrolyte levels. Many doctors do this routinely for patients on certain medications. But if yours hasn't checked recently, or if you've never had this conversation, it's worth bringing up. Muscle weakness that's new or worsening also deserves attention on its own, separate from electrolytes, because it can be related to circulation, nerve function, or other factors your doctor will want to evaluate. When do you call? When cramps are severe, frequent, and disrupting your sleep regularly. When you notice new weakness in your legs that's affecting how you walk or climb stairs. When the tingling or strange sensations are persistent and getting worse. When it's been more than 6 months since your last blood work, a blood test. That's often all it takes to answer the question. Don't spend months wondering when the answer might be one appointment away. Sign number 6, an irregular heartbeat, palpitations, or a feeling of offness in your chest. Here's how people describe it. It feels like my heart skips a beat sometimes. There's a fluttering feeling, not painful, but noticeable. Occasionally it beats really fast for no reason, then goes back to normal. I can just feel it, like it's working harder than it should. This is a sign that people often minimize because it comes and goes. They think, if it were serious, it would be constant. So they wait, they watch, they hope it passes. Here's the honest truth. Occasional brief palpitations, a skipped beat here and there, especially tied to stress, caffeine, or poor sleep, are common and often harmless. But palpitations that are new, frequent, or accompanied by other symptoms are worth reporting. Blood pressure medications work on the cardiovascular system. That's their purpose. But the cardiovascular system is complex, and any medication that affects it can, in some people, influence heart rhythm, especially when combined with other medications, supplements, or underlying conditions. This isn't a reason to fear your medication. It's a reason to stay in communication with your doctor. When do you call, or go in sooner? When palpitations are happening multiple times a week. When they last more than a few seconds and feel intense. When they come with dizziness, lightheadedness, or chest discomfort. When they're new, You never felt this before starting or changing your medication. When you feel like your heart is racing and you can't explain why. Your heart has been beating for you your entire life. If it's trying to get your attention, listen. Because this is the sign, or really, the group of signs, that I consider the most important in this entire video. This is the one I want you to remember after everything else fades. There's a rare but serious reaction that can occur with certain blood pressure medications, including Losartan, called angioedema. It involves rapid swelling, usually in the face, lips, tongue, or throat. It can make it difficult to swallow or breathe. It can develop quickly. If this happens, do not wait. Do not call a family member first. Do not search online. Call 911 immediately. This is not a monitor and see situation. This is an emergency. Beyond that, here are other symptoms that should prompt you to seek evaluation this same day, not next week. Sudden, significant shortness of breath, especially if it comes on while you're resting or lying down, or if it wakes you up at night. Swelling that appears rapidly, not gradually over weeks, but noticeably worse over hours or a day or two, especially if it involves your face, hands, or abdomen alongside your legs. Fainting or near fainting, losing consciousness, even briefly, or feeling like you're about to pass out. Sudden confusion, difficulty speaking, or trouble understanding what's being said to you. These can be signs of something affecting the brain that needs immediate evaluation. Chest pain or pressure that is new, significant, or different from anything you've felt before. A headache that is sudden and severe, unlike any headache you've had. The kind that feels like it arrived out of nowhere and hits hard. I want to pause here, read that list again if you need to. Because these aren't symptoms to write down in a journal and bring to your appointment in 6 weeks. These are symptoms that deserve a phone call, an urgent visit, or in some cases, a call to emergency services. You've been responsible enough to take your medication every day. You've done what your doctor asked. Now I'm asking you to extend that same responsibility to your symptoms. You deserve to be heard. And your doctor needs the chance to hear you. Now I want to talk about something that I hear about constantly, in comments, in messages from people who write to me and say, I didn't know I was doing this wrong. The mistake that shows up more than any other. It's not dramatic. It doesn't look like a mistake when you're doing it. But it is. Here are the 3 versions of this mistake. Version 1. I take it when I remember, day on, day off. Sometimes twice in one day, to catch up. Sometimes skipping weekends because they feel better and think maybe they don't need it then. Blood pressure medication is designed to work consistently, at the same time, every day. When the levels in your body go up and down unpredictably, your blood pressure does too. And that inconsistency is harder on your cardiovascular system than a steady routine. Version 2. I stopped on my own because I felt fine. This one is especially common, and especially understandable. You start taking the medication, your blood pressure improves, you feel better, and a thought appears, maybe I don't need it anymore. Maybe the lifestyle changes I made were enough. Maybe my body fixed itself. Here's the gentle truth. Feeling fine is often the medication working. Stopping it without guidance can cause blood pressure to rise again, sometimes quickly, sometimes dangerously. If you want to explore reducing or stopping your medication, that conversation is absolutely worth having with your doctor. There may be a path there, but it needs to be supervised and gradual. Version 3. I've been having symptoms for months, but I didn't want to bother anyone. A 71-year-old man, I'll call him Robert, had been feeling short of breath when he climbed stairs for nearly 8 months. He told himself he was just getting out of shape. He didn't mention it to his wife. He didn't mention it at his checkup because the doctor seemed busy, and he didn't want to take up time with something he wasn't sure about. When he finally mentioned it, almost by accident, at the end of an appointment, his doctor ordered tests that same day. 8 months. Your symptoms are not a burden. They are information. And your doctor needs that information to take care of you properly. Here's a simple habit that can change everything. Keep a small notebook or use your phone and write down anything unusual you notice. The date, the symptom, how long it lasted, what you were doing, how severe it felt on a scale of 1 to 10. When you walk into your next appointment with that list, you give your doctor something invaluable. A timeline, a pattern, a story that your body has been telling, finally written down in a way that can be acted on. That's not being a difficult patient. That's being an informed one. I asked if you'd ever noticed a symptom, a tiredness, a swelling, a dizziness, and told yourself it was just age. Most of us have done that. It's human. It's how we cope. We don't want to worry. We don't want to make a fuss. We don't want to be the person who's always at the doctor. But here's what I want you to walk away with today. Paying attention to your body is not weakness. It's not paranoia. It's not being a hypochondriac. It is the single most important form of self-respect you can practice. You've spent decades taking care of other people, your children, your parents, your spouse, your co-workers. You've shown up for everyone. Now I'm asking you to show up for yourself. Not by panicking over every sensation. Not by diagnosing yourself online at midnight, but by noticing, by writing it down, by saying it out loud at your next appointment. Doctor, I've been having this for a few weeks. I wanted to mention it. 7 words. That's all it takes to start that conversation. Losartan and Amlodipine are good medications for millions of people. They are not the enemy. But they, like all medications, deserve to be monitored. And you, like all patients, deserve to feel heard. If your current doctor doesn't make you feel that way, advocate for yourself. Ask your questions. Bring your list, and if needed, seek a second opinion. You have every right to be an active participant in your own health. Before you go, I have one small request. Right now in the comments below, tell me, which medication do you take? Losartan, Amlodipine, or something else? And which of these 7 signs made you stop and think? Your comment might be exactly what someone else needed to read today. Someone who is about to close this video and go back to telling themselves it's just age. You could change that for them. If this video helped you, or if you know someone who needs to hear this, please share it. And if you haven't already, hit that like button. It takes 1 second, and it means more than you know. And one more thing. Right there on your screen, there's another video I think you're really going to want to watch next. It covers something that most people on blood pressure medication have never been told. And once you know it, you'll wish you'd known it years ago. Go ahead and tap it. I'll see you there.